One of the necessary but somewhat frustrating things that new parents talk about is burping their baby. It raises all sorts of questions, including how to, when to, what if there's no burp, how hard do you pat, and so forth. That's why we made this video series to help with at-home newborn care. This video will cover burping techniques. My name is Gladys, and I am a maternity nurse specialist for parent education at NYU Langone Medical Center. Burping your baby isn't always easy. Actually, many new parents consider it a challenge. We're going to demonstrate 2 burping techniques, over the shoulder and on the lap. We'll answer some frequently asked questions. Remember that the reason you burp your baby is to release gas. This is the air that the baby may have taken in during a feeding. Babies feel better after burping, and the activity helps stimulate the baby too. For the over-the-shoulder technique, you can either do this sitting or standing. Try them both out and see which works best for you and your baby, or you can alternate sitting and standing. To start, hold the baby up on your chest so the baby is facing toward you, with your arm tucked under the baby's bottom for support. You'll want to put a burping cloth over your shoulder in case the baby spits up. Use your dominant hand to gently but firmly pat your baby's back between the shoulders, working your way up and down. You can also rub the baby's back after several pats. After a while, you'll get to know your baby. You'll learn what seems to work best. Keep in mind that breastfed babies tend to burp less because they take in less air than bottle-fed babies. And sometimes babies don't burp at all, which is perfectly normal. Burp your baby for about a minute and then continue feeding. If your baby seems upset and is crying, try standing or rocking your baby or talking to your baby. The second technique is where your baby is sitting on your lap. Placing a burp cloth on your leg, the position looks like this. You can use either leg, with the baby facing either way. Notice that one open hand is holding the baby's jaw. The forefinger and thumb are used as a sort of wedge, with the palm supporting the chest. Using firm but gentle pressure, tilt and support the baby's head up a little. At first, it may seem a little awkward, but after some practice, it will be second nature. Remember that there is nothing wrong if the baby does not burp every time. And if the baby spits up, just wipe and continue. Again, use your dominant hand to gently but firmly pat your baby's back between the shoulders, working your way up and down. As we mentioned, you can also rub the baby's back after several pats. One common question parents ask is how often to burp their baby during a feeding. We recommend burping your baby after the baby feeds with each breast. But if you have expressed your breast milk and someone else is feeding the baby, try halfway through and again after the feeding. You may notice that if your baby starts to fuss while feeding, this may indicate the need to burp. Be patient as you learn what your baby needs and likes. Burping your baby is another activity that gives you hands-on contact as you touch, hold, and talk with your baby. All of this adds to the bonding experience. As you gain experience, burping your baby will also be a confidence booster for you. After all, there's